Lumecca uses intense pulse light, IPL, to selectively target and treat skin conditions through a process called selective photothermolysis. Optimized for light and dark skin, Lumecca increases the potential for clinicians to treat a variety of skin types and conditions ranging from facial pigmentation, superficial vessels, skin texture, and/or photo damage. Lumecca can be used on skin types 1 to 4. Refer to the quick reference guide for treatment parameter guidelines. When starting a procedure, ensure the patient's skin is clean. Using 70% rubbing alcohol pads or 12-ply gauze saturated with alcohol, gently wipe off any makeup, dirt, or oil on the selected treatment area. After a patient's skin has been cleaned, apply a thin coat of clear ultrasound gel. Start the treatment with a test pulse near the ear or back jawline to ensure you have the correct settings. The spot test should be in an area that has similar skin tones to the treatment area. For an accurate assessment, remove your operator goggles and gel to see the skin's response. Make sure there is not too much erythema in the treatment area. After waiting a few minutes and assessing the skin, you can continue on with the treatment. There are 2 options for pulsing. You can pulse slowly, 1 pulse at a time, called single pulse, or we can set it to auto repeat mode and auto pulse at a normal or fast rate. Make sure to always assess the skin throughout the treatment. Look for erythema, which is some redness, excessive heat, or bruising. Edema or slight swelling may also be evident during or after treatment. A positive response is light erythema and some mild edema. This ensures that you are affecting the targeted red and brown spots. When pulsing, we want to pulse from bar to bar with no overlap. Going from crystal to crystal 1 at a time, you can use the track marks left in the gel as guidance. If you are a new practitioner or provider, you may want to use the manual pulsing or have the pulse move set to off so that you have enough time to ensure proper placement of the treatment bar. The orientation of the Lumecca handpiece can either be vertical or horizontal. The preference is up to the provider. There is no one correct way to hold the handpiece. However, we want to always ensure that there is full placement on the skin, avoiding hair, suspicious lesions, permanent makeup, the eyes, and the lips. When treating contoured areas on the face, such as the nose, you do not have to have 100% contact with the skin. However, it is more effective and safer to have full skin contact. This may require you to adjust your Lumecca handpiece for the best coverage. Repositioning the pulse to be alongside the bridge rather than across it is one example of an adjustment an operator can make. However, not having full contact is still allowable, as there is no arcing since this is not an RF device. It uses intense pulse light. For the lip area, we want to avoid the vermilion border. Place the crystal right above the vermilion border. Some clinicians position a tongue blade on the vermilion border to protect the lip from being inadvertently treated. Ensure that there's always gel in the area that you are treating. Under the lip, you can treat below the vermilion border. The handpiece is very ergonomic, so you can achieve proper placement in all areas of the face, including the nose, to treat broken capillaries. When treating under the eyes with the patient's goggles on, pull the patient's cheek to expose more of the eyelid skin. Pull the skin downward using either your tongue blade or dry gauze. With the other side, pull the cheek down to expose more skin and pulse right under the eyelid. That way you're still protecting the patient's eyes while treating the lower eyelid skin. On the forehead, apply a thicker layer of gel as this is a bony area. This will ensure proper cooling of the skin and full contact. If the forehead area is darker than the rest of the face, lower the fluence to avoid overheating. Move the goggle straps and treat the temple area. You can protect the eyebrow with a tongue blade and treat right above it. For the row, protect the eyebrow and then the glabella region once again. Treat while protecting eyebrow hair. You can keep track of your pulsing by the marks of the gel and also by pulse counter on the machine. An entire Lumecca treatment can be done in about 10 minutes. If erythema is mild, a second pass may be performed in certain areas where there are more blood vessels or brown spots. Repassing the treatment area oftentimes will result in even better outcomes. You may also increase the fluency per skin tolerance by 1 or 2 joules. To target and treat blood vessels on or around the nose, treating or repassing the area may achieve better results. For vascular indications, look for tissue response, including a reduced vessel size or for larger vessels darkening. To assess the treatment area, move the gel to determine whether a second pulse is needed. In this patient case, we can see some nice erythema, however it is very light, indicating a very conservative treatment. This patient has redness on her nose, on the sides and top, so we should repass this area to provide even better results. She has some brown spots just in different areas that are starting to darken, and this is one of the end points we would like to see. However, with the second pass, we can see a more dramatic response and even better outcomes. With Lumecca, it is common to perform 1 to 2 treatments once a month, as opposed to traditional IPLs, which commonly require 3 to 5 treatments. Even when treating with conservative fluences, Lumecca typically requires fewer treatments with better results. When doing a second pass, make sure to apply more gel to the skin. We can treat this patient at the same setting or 1 joule higher for her broken blood vessels. You can change the pulse duration to long pulse, which would be half the fluence in milliseconds, or increase the fluence so that you are heating and affecting the vessels more. In some cases, when treating with short pulse durations, purpura may result, which may look like a bruise. Patients often do not desire bruising. To reduce the risk of purpura, use long pulse or the longer wavelength, the 580 applicator. Longer pulse durations will reduce the likelihood of purpura. Longer pulse durations may require a second pulse. Always make sure to assess the skin with the end point being erythema. When in auto repeat mode or fast pulse, one can glide the applicator or continue to lift and place. Usually in more sensitive areas, we can pulse a little slower to allow the skin to cool. The first pass was at 13 joules using short pulse and strong cooling. The second pass is at 16 joules using long pulse and strong cooling and a fast repeat mode. When treating the eyelid area, avoid the hairline, eyebrows, and permanent makeup. For the forehead, reduce the fluence about 20% as indicated in the quick reference guide, 1 or 2 joules. You may smell some hair burning due to facial peach fuzz. Lumecca may diminish facial peach fuzz. Lumecca may also affect male facial hair, so do not treat males in areas they do not want to have facial hair removal. Ensure to continually check the patient's skin throughout the treatment. After the procedure, clean the patient's face and apply post-treatment moisturizers and sunscreen. Instruct your patient to avoid sun tanning, direct sunlight, and apply a high SPF, something greater than 30 sunblock. When treating the neck, reduce the fluence about 20% if you are treating 10 joules here. You want to lower your fluence to 8 joules on the neck, whether at short or long pulse. If the patient has more pigment, sun damage, or color while treating the neck, decrease the fluence further. When going from the neck to the chest area, lower your fluence by another 20%. You can either start lateral neck or central neck. It is your preference as the provider. Usually the neck is very tolerable and comfortable. The only time it is painful is if your parameters are too high. If the patient complains of discomfort from burning or heat, stop pulsing and assess the skin to ensure that the skin is responding in a safe way and it is not too hot or too red. Usually we avoid thyroid area to prevent any kind of thyroid response to the heat. If there are any visible suspicious lesions or moles, avoid pulsing over these lesions. Remember, the body is not flat, but rather contoured. Pulse with the contour of the body or area you are treating. When treating pigmented lesions such as freckles, birthmarks, or other non-suspicious lesions, typically the discoloration is darkened through the years of sun exposure. Areas like this should not be treated by a beginner provider due to the fact that the provider is not familiar with Lumecca or any IPL system. Being that it is dark, we have a 580 wavelength that we can use in long pulse mode at low fluency. We want to test this area for the first session to ensure proper response and recovery. If she feels no heat or we see no change or erythema, we can increase the fluence by 1 joule and do a second row. Apply a thicker layer of gel to protect the skin even more. When treating with the 580 applicator in long pulse mode, the fluence has been set to 6 joules with very strong cooling. To be extra conservative, pulsing will not be at fast pulse mode, but rather 1 pulse at a time. Remove the gel to make sure you can see the response. If she feels no heat and we see no change or erythema, we can increase the fluence by 1 joule. Let the treatment sit for a while treating the other side. Since the other side of the chest does not have the darker spot, we can increase the fluence to achieve a better result. On the non-pigmented side of this chest, we reduce the fluence from the neck, being 12 joules short pulse with 580 applicator to 10 joules short pulse strong cooling on her chest. On the pigmented side, we are starting to see some change in the pigment. As you can see, there is some erythema in the area of the mark. With our first row of pulsing with the lower fluence at 6 joules, we see no response at all. At 7 joules, we do see a response. We can pass this area here with 7 joules and achieve a skin response like we did in the first area where we see change. Here are some important endpoints to take into consideration when using Lumecca.